Hi everyone, I'm Shreya Patel. Welcome back to my YouTube channel. Thank you for watching my last video, and today I'm going to talk about NCLEX exam. But if you are new to this channel and want to know about how to become RN in Canada, so watch out my previous video. So let's learn about NCLEX today. First, let's talk about what I'm going to discuss in this video. I have tried to cover all the topics regarding NCLEX. So I'm going to explain you about NCLEX and types of NCLEX, difference between NCLEX RN and PN, how to register for NCLEX, and focus areas and exam format. So let's get started. So first, let's talk about NCLEX, National Council Licensure Examination. This is an entry to practice exam for the nurses in some countries such as Australia, USA and Canada. Let me tell you briefly about NCSBN, which is an examination board through which you register for NCLEX, which I tell you in detail later on this video. But whatever country you are applying to write NCLEX, NCLEX board will remain same, and it will test your ability to safely practice as a nurse. Next, who has to write an NCLEX exam? It is for everyone who wants to start their practice and wants to work in previously mentioned countries. It will give you a license to practice once you pass an exam. Some requirements will be different from state to state, but NCLEX will remain the same. Now let's talk about types of NCLEX. NCLEX has two types, NCLEX RN and NCLEX PN. NCLEX RN is for the registered nurses and NCLEX PN is for the licensed practical nurses. Both the exam pattern is overall same, just the level of difficulty of the question will be different, as NCLEX RN is for the registered nurses who has done like a 4-year degree from outside Canada or inside Canada or any other country, and NCLEX PN is for the one like who have studied diploma courses. Another difference in the NCLEX RN and NCLEX PN is for the nurses scope of practice. Both the nurses can work in similar setting, but such as hospital, community and home care, but the scope of practice can be different as per their regulatory bodies. Let's talk about how to register for NCLEX. In my last video, I have discussed how to get NCLEX eligibility. So once you get NCLEX eligibility, you need to create an account with NCSBN. As I mentioned previously, it is an examination board. You need to pay all the registration fees, and then they will send you an ATT. But ATT you will receive from your registration board, which is like, for example, I have applied my NCLEX eligibility through Australia. So AFRA sent me and ATT, but I opened my account with NCSBN. So similarly, according to what country or what board you are applying, but you have to create an account with NCSBN to register for NCLEX, and then once you get ATT, you can book your exam at any test center at Pearson VUE. Pearson VUE is like an examination center. So I hope everything is clear until now. Next, we will discuss on focus areas on NCLEX. So these are the listed focus areas on which NCLEX will ask a question. It includes management of care, health promotion, basic care and comfort, pharmacological, and all the health promotion questions. So these are the criteria on which NCLEX will ask you questions. Now let's talk about exam format of the NCLEX and how NCLEX works. So NCLEX using a computerized adaptive testing. Every time a question is answered, the computer will base the next question on whether you answered the previous question correctly or not, which means if you are answering first question correctly, then your next question will be a little bit of higher difficulty. If you are answering it wrong, then it will be a little bit of lower level of difficulty, or maybe the similar level of difficulty. So that's how NCLEX works. If I tell you about exam format, so it has minimum of 85 question and maximum 150 question. There will be case studies as well, and time duration for the exam is up to 4 hours, and also it has a partial scoring for the SATA questions. So yeah, that's all about NCLEX exam pattern. Next, let's talk about how hard NCLEX is. As I got so many times people asking me how hard the NCLEX is. So if I say honestly, yes, it is hard, but it's also very tricky. It will make you think. So for that, you require more practice and more study. But if you have studied well and practiced enough, then and you have like a good understanding of how to think critically, then maybe you will not say it's hard. So yeah, that's all about NCLEX. Thank you for watching my video, and if you have any questions regarding NCLEX and another topic, feel free to comment down in the comment section, or you can also reach out to me on Instagram account as well. Please like, share and subscribe my channel, and share it with your friends too. Thank you.